About 1.6 million people worldwide currently suffer from a nosocomial infection. In developed countries, between 5 and 10% of inpatients develop an infection while being treated in a hospital. This can reach up to 25% in poor or developing countries. There are many causes of infection, including the lack of hand hygiene. We're here in Phnom Penh, the capital of Cambodia, located in the heart of Southeast Asia. It wants to socially and economically join its two neighbors, Thailand and Vietnam. In August 2014, the Cambodian government committed itself to the World Health Organization's campaign promoting hand hygiene in hospitals. This campaign aims to halve infections acquired in hospitals through generalizing the practice of rubbing hands with a very effective alcohol-based hand rub solution for caregivers, patients and families. This simple and almost obvious act is a symbol of a reinforced health policy here in Cambodia.
Promote the hygiene and the sanitation and prevention measure in the hospital. That's very important. We use some means, some tool, some activity related to infection control, like hand washing, hand washing. The others, you see that is sanitation related to the control of the infection in the hospital.
With 15 million people, Cambodia is the 134th country to join the WHO campaign launched in 2005. This means that one more country on the world map has acknowledged the existence of an international health reality that's wreaking havoc.
It's clear that this is a very critical time for the government to decide and to recognize that infections exist in hospitals. Remember that there are still many countries around the world where officially there is no hospital infection. So it means that the transparency about hospital infections does not exist. By the signature of the Ministry of Health, it changed everything in the country. Then, of course, when the signature has been given, there are different possibilities. Either the government will allocate some resources with a team to say, okay, why don't we embark in a national campaign? Or the government will sort of help a hospital or another structure to further develop the concept according to the WHO initiative, or individuals or single hospitals will be leading so well that they could lead other hospitals in the country, and then the Ministry of Health could simply say, why don't you follow this example? So anyway, the pledge is always important.
Clean Care is Safer Care is a universal WHO campaign based on creating practical and educational tools to enable health professionals to promote and implement hand hygiene in practice.
វេលាទី1 មុនពេលប៉ះអ្នកជំងឺ វេលាទី2 មុនពេលធ្វើទម្រង់ការសេពតិក វេលាទី3 ក្រោយពេលប្រឈមនឹងការប៉ះវត្ថុរាវចេញពីអ្នកជំងឺ វេលាទី4 ក្រោយពេលប៉ះអ្នកជំងឺ វេលាទី5 ក្រោយពេលប៉ះវត្ថុជុំវិញអ្នកជំងឺ
Hand hygiene is an issue that transcends all geographical, cultural, administrative and financial boundaries. In 2012, the WHO created the POPs, which stands for Private Organizations for Patient Safety. This is an exchange and knowledge-sharing platform for private organizations and companies specializing in patient safety. Among them, the Japanese company Soraya is involved in this process to promote the training of health workers and ensure the availability of hand hygiene products.
I think Didier has been successful to make 150 countries now, but there are still some. And Cambodia was one of them. They signed today. I think each hospital needs some support from the government, you know. So it's a kind of joint project with the government, NGOs, or you know, local, and also the hospitals and WHO. I believe that this thing can be sustained through business processes. You cannot donate, you know, things, you know, for many years. It may be changed, but through the business process, it can be very sustainable. So that I work together with Cambodian government, and today, Ministry of Health organized the project. We supported this event. I think it was a very successful event.
In Cambodia, Soraya teams assisted several hospitals in the capital 6 months before signing the WHO Convention Pledge. Visits, education and training were essential components of the assistance provided by Soraya teams.
A hospital we visit in the morning, it's called National Pediatric Hospitals, and it's one of the hospitals in our pilot project with JICA projects. And here is a National Maternal and Child Health Center, and it's also one of the hospitals in our project too. So for both hospitals, I am in charge of supply alcohol to the hospital every week. So we do around checks every week to see the alcohol is running out or not, and there is any blockage of the dispenser or not, and they are preferred in using our alcohol or not. And besides that, I also in charge of contracts and communicate with the hospital staff to make a training, the seminar of hand hygiene, and to arrange for many like a site visit to the hospital as well.
Cambodian people, they like to use something for new. Especially those kind of dispenser is very, very new for them. So I think they're very interested to use. So we did it, this project for half a year. So the consumption was very good because everybody very interested to use it and everybody enjoyed to use it. Especially alcohol, they're using not high quality. Actually, they are using, they were using lower alcohol. So their hand was very easy to get rough or scotches, those kind of stuff. But our product has like a moisturizer, so it doesn't have any rough or it's less scotches. So they're very enjoying to use it and very happy to use it.
Behind this global hand hygiene program is one man, Didier, professor of medicine at the University Hospitals of Geneva. He developed the Clean Care is Safer Care program with the WHO. Professor Didier is very well known in the four corners of the world as he travels around promoting hand hygiene in healthcare facilities to encourage medical teams and foster their creativity and enthusiasm. The success of his action also requires collective awareness and the education of the patients themselves.
មុនបងយើងនេះលាងហើយជុកដៃយើងជូតជាមួយកសែងស្អាតហើយប៉ះ baby.
Yes. And is it difficult for you to do it?
ជាការងារស្រួលកុំឲ្យយើងមានជំងឺ
What did you say?
Not difficult.
It's not difficult. And you think it's good for the baby?
ល្អទេដើម្បីកូនធ្វើអញ្ចឹងល្អ
ខ្លួនអញ្ចឹងដើម្បីកុំឲ្យវាមានឆ្លងជំងឺពីមួយទៅមួយ
to decontamination.
Yes, it's exactly that. Thank you very much. Thank you. I was really pleased to see that these patients, where we were talking about hand hygiene even before we would speak about the hand rub, were actually understanding that, you know, hand hygiene is important, probably because those populations are, as you know, poor. As you understood from our discussions, a woman would have at least 4 children, maybe more in the countryside, and it's not for no reason. It's because they need to have a lot of children to help them grow up and feed them and grow up in the society. So it means that they probably are aware of the importance of hand washing, and when they come to the hospital, they really understood very well that they could be part of the strategy. And when we teach them how to hand rub, they were pleased and they knew about that, they knew about the importance, and they were ready to teach their family.
No, I think in the hospitals, if they invest some money for the prevention, it seems that they spend some money. But in the end, they save a lot of money, like 20 times more money that can be saved through hand hygienes and through hygienic activities. So I think they have to realize this. Regarding this event, we think it's a kind of long-term asset investment that we came together with the Ministry of Health, and also we should be competitive in providing affordable product to them, to provide some educations through the business process. But I think this is a kind of new approach, and I hope this will be a very successful kind of social private sector business. Yeah.